There are many different types of contraceptives available, and it's very important that women should find out about all of them so that they can make an informed choice. Condoms, whilst they're readily available and are very good protection against sexually transmitted infections, are recommended to be used in conjunction with another, more reliable method of contraception. The cap is a small, soft rubber dome that's placed inside the vagina just prior to intercourse, together with some spermicide jelly. It's a very good method of contraception. It's ideal for women who don't want to use any hormonal method. There are two types of contraceptive pills. There's the combined oral contraceptive pill that contains estrogen and progesterone, and also there's a mini pill that only contains the progesterone. So if a woman doesn't want to have estrogen, we can offer her a progesterone-only pill. Apart from the fact that it makes the periods very light and short and pain-free, it also, the combined oral contraceptive pill, reduces the risk of 3 types of cancer by 50%, which is a huge health benefit. They are both very good forms of contraception, but they do rely on the women remembering to take them. If a woman doesn't want to have to remember to take something every day, but wants something that's completely reliable and puts her completely in control, then the long-acting reversible methods of contraception are highly recommended. The LARC methods are very suitable for all women of all age groups, including women who haven't had any children. The implant is a very discreet 4-centimetre little tube which is full of progesterone hormone. We inject it subdermally, usually in the upper arm, so that it can be felt but not seen, and it is very, very effective contraception for 3 years, so it really is fit and forget for the woman. It can be taken out any time that the woman decides to change to another method, and when it is removed, fertility returns to normal within a month. The IUS is an intrauterine device that is fitted inside the uterine cavity. It contains a very small amount of progesterone hormone, which is released over a 5-year period. It has this wonderful added benefit of not only being very, very good contraception, but making the periods very light and very short. And in fact, in 85% of women, the periods will stop after about 6 months. Once it's removed, fertility returns to normal within the first month. It's very easy to fit and is a very simple procedure that can be just done in the clinic. Once it's in, people aren't aware that it's there at all. The copper IUD is another intrauterine device that has no hormones in it at all, but just copper. And this is ideal for women who want to have a method that is highly reliable, but that they don't have to think about, without having any hormones. The copper actually acts as a spermicide, killing the sperm, and it's very, very good contraception. Again, once it's removed, fertility returns to normal immediately. The only downside of the copper IUD is that it can cause the periods to become slightly heavier and slightly longer. Most of the copper devices available that we use in this country last 10 years. There is another benefit to using this method. It has been shown that it reduces the incidence of endometrial cancer by 50%. The IUS and the copper IUD are suitable for all women of all age groups. The contraceptive injection is often called the depot injection. This is very, very good contraception, and it is given once every 3 months. It often makes the periods disappear altogether, which women love. Whilst it is very popular contraception, women have to bear in mind that there can be a delay in return of fertility once they stop taking it. And it can take 18 months for the fertility to return to normal. As a last resort, there are two methods of emergency contraception available for women who have either had a contraceptive failure or who have failed to use any method at all. These consist of the emergency hormonal contraceptive pill, and also there is a copper intrauterine device that can be fitted. So whichever method of contraception is best for you, always remember, in order to prevent sexually transmitted infections, also always use a condom.